Hi, I'm Paul Jennings, writer for the Oregon Health Authority, and I'm joined today by Dr. Shimi Sharief so that we can talk a little bit more about the Delta variant. Thank you for joining us, Dr. Sharief.
Thanks for having me, Paul.
So we continue to see in the news that the Delta variant has arrived in Oregon. So what exactly is the Delta variant?
So the Delta variant is one of many variants of concern, as we call them, that's been circulating since about March or April of this year. Soon after we came to the pandemic here in the United States, we were already starting to see some variants starting to circulate. The Delta is one that was originally identified in India. A variant is basically a natural process that happens in a virus's life cycle. It encounters people with either some or a lot of immunity, and then it knows how to adapt to go infect the next person. So these are mutations that happen naturally in a virus, and we call them a variant of concern if a virus has happened to find a way in which to either escape our immune responses, either by not working as well against some medications or vaccines that we have, or it has a way to transmit to more people than a previous strain was able to, or else it also can't be detected with the same testing tools that we usually rely on. The Delta variant right now is one of those variants that's circulating, but our vaccines seem to be promising and they work really well against this variant.
So you mentioned testing a minute ago, and I'm just curious, how is it that you do test for the Delta variant, and at what point would a doctor order advanced studies to see if maybe that is the variant that they're looking at?
So the Delta variant can be tested for using a technique called genomic sequencing. That's basically looking at the genetic code for this virus, and specifically the spike protein DNA, because that seems to be where our biggest concern is, because a lot of our vaccines and our monoclonal antibody therapies are created in such a way as to identify that spike protein and neutralize the virus before it has a chance to infect our bodies. What labs do to identify the Delta variant is they have a certain set of criteria. Some of these criteria for our Oregon Public Health Lab can actually be found on our website, and we can link that below. But the labs sequence these viruses when we have a test that's been submitted. And oftentimes, if the criteria are met, especially in an outbreak setting or if it's a breakthrough case, so it's a person who has been vaccinated before and they seem to have symptoms of COVID-19, then these get automatically sequenced. In addition to that, there are some private labs across the state, usually those belonging to academic centers, that also sequence their samples based on different criteria.
And you also talked about how the Delta variant or other variants of concern might be resistant to treatment. Is that true of the Delta variant?
So far, it doesn't seem to indicate that a lot of our monoclonal therapies have any resistance issues posed by the Delta variant. This is compared to the Gamma and the Beta variants, which seem to be more of a problem. In addition to that, our vaccines work really well against this variant, and specifically, even though there's a slight reduction in symptomatic disease prevention, so this would be any person with any symptoms of COVID-19, a cough, shortness of breath, fever, might be a little bit lower than with the original strain of the virus or previous variants like the Alpha variant, but we do know that for severe disease or hospitalization and even death, that these vaccines work just as well as they did with the original trials.
And just to make sure, is there any difference in how effective each vaccine is in preventing these serious COVID-19 symptoms?
So there are differences vaccine to vaccine, depending on the vaccine. So Pfizer, Moderna, or Johnson & Johnson have slight differences in efficacy against each other. But what seems to be consistent is that their efficacy against the trial data, which was originally published, seemed to be pretty preserved. In studies coming from the UK and Israel, there seems to be different estimates based on vaccine, but they're still very effective against severe disease and death. And the same thing goes for Johnson & Johnson, where we have some early neutralizing antibody data, which indicates that the vaccines can last for up to 8 months just with a single dose, even against the Delta variant. But we are lacking a little bit of real-world evidence for the Johnson & Johnson vaccine compared to the other two, because not as many countries are using the Johnson & Johnson vaccine as they are with Pfizer or Moderna.
Now we're looking at Delta variant spread, and how contagious is it really? How quickly is it spreading right now?
So the Delta variant is much more transmissible. It can infect a lot more people. One person can infect a lot more people. And especially what we're seeing is that a lot of our new infections, especially among the unvaccinated people, are actually rising because of the Delta variant. We've also noticed a trend that younger people can get sicker with COVID-19, and that seems to be partially also because of the Delta variant, and partially because we're opening up society, reducing masking requirements as well as physical distancing requirements, so all of those contribute. But the main thing is that the Delta variant can infect more people in a shorter amount of time than the other variants can.
So with all this information in mind, do we need to be doing anything differently to stay safe from the Delta variant?
The main thing right now is people should consider getting vaccinated, especially if you're, between doses. We recommend that you go get your second dose because partial immunity can be another way for variants to continue to spread and also create more dangerous variants. So the best tool that we have right now is vaccination. In addition to that, masking continues to be another tool that we have. So we recommend if you are immunocompromised, either you have a condition that causes your immune system to not work as well, or you're on medication that might do the same, to continue to wear a mask, especially in crowded indoor settings. And we recommend at all times that unvaccinated people or partially vaccinated people, before you get your second dose and are 2 weeks after that dose, that you continue to mask.
So you've mentioned here that the vaccinations are incredibly effective at preventing severe COVID-19, but how serious is illness for people that are unvaccinated?
So right now, we don't have evidence to show that the virus causes more severe disease than some of the other variants that have circulated or are still being transmitted. But what we do know is that there's more of a likelihood that you can be infected just because of how transmissible it is than some of the other variant strains.
And children under 12 still aren't eligible for vaccination right now. School is right around the corner. Should masking and physical distancing policies be different for them?
So, our school guidance was never really fully dependent on vaccination rates. We always recommend people refer to our Ready School Safe Learners guidance because there's a variety of factors that go into reopening schools, as well as determining what guidelines make sense for a particular school. And what Ready School Safe Learners does is it gives the authority to the local officials, including a local school board and the local county officials, to actually determine what makes sense for their locality.
So I've heard talk online about the potential need for booster shots. Are those required right now?
No, boosters are not required. Furthermore, we don't actually have data to indicate that boosters are necessary because we actually don't have any papers indicating waning immunity yet, as in, Pfizer and Moderna have been noted to be effective for at least 9 months, if not longer. The earliest vaccinated people were vaccinated middle of December, and those are our healthcare workers, and they haven't needed boosters yet. Furthermore, a booster at this time, given the limited data that we have, especially data that doesn't show waning immunity, would be outside of scope of the federal EUA at this point. And our recommendation is that we stay within the scope of the EUA and that anything administered outside of the EUA would actually need formal discussion with the FDA and the manufacturer. And we recommend that providers do that if they need to on a case-by-case basis, depending on the patients they treat.
So overall, how do you recommend that we stay safe moving forward?
So we recommend that you get vaccinated. That's like the biggest tool that we have to continue past this surge of our pandemic, as well as possibly future surges that we may run into. In addition to that, we recommend that masking is another tool to continue to protect yourself. We recommend that, even though the statewide mask mandate has been lifted, businesses are fully within their jurisdiction to have different masking policies compared to the general public. And so we recommend that you have a mask handy if you were to access a business that might have a different policy.
Awesome. Dr. Sharief, thank you so much.
Thank you.